that we should also talk about the misconceptions of hospice. When people hear the word hospice, immediately they think of cancer and death, and they think, I'm not dying and I don't have cancer. Why do I need the services?
So how do you have that conversation? So somebody says to you, listen, I'm not dying. I don't need hospice. I'm not sure why you're here. What's the conversation that you're having with them?
Well, I do a lot of public speaking. So when I go out and I do public speaking, I oftentimes take something, a donut, a cookie, coffee, something. And when I stand up and I tell people that I represent hospice, the first thing they do is immediately everybody's eyes leave me and go to the floor. They think, I'm not dying. I don't have cancer. Why is this woman here? So oftentimes I'll go around the room and say, has anybody here ever had a personal experience with hospice? Usually you'll have at least one or two people in the room who give a testimonial. They'll say, you people are angels, you're amazing, you helped my sister, you helped my mother, you helped my father. I value the services so much. And that's where you start talking about hospice, because hospice is more than cancer, it's more than death.
And I've experienced that again, countless times with our patients. One of the things that I will share as my personal story about hospice is the way that it was able to help my grandmother transition home. So my grandmother was actually participating in the Allegheny County waiver programs, which we'll talk about as well in future segments. And she was in a nursing home after a lengthy stay in the hospital. And she was brought from the hospital into the nursing setting with a trach. And the problem was that unless we had the care for her that was essentially 24/7, she wasn't able to come home. And the problem with her being in a nursing home was that the therapists weren't able to get her to pretty much do anything. I mean, she wasn't interested. So the family did decide to bring her home on services. And after providing therapy services for her, we realized that she really was the ideal candidate for hospice. And we were able to contact hospice, have the conversation, have the physician involved, and she was able to receive hospice care. After a while, her diagnosis improved. So she was no longer eligible for hospice, and she came off of hospice and right back into home health, essentially never losing any time and never losing any care, which I thought was absolutely tremendous, because the rehabilitation process for her at home was a lot better than it would have been. And it happened to be that she was very much satisfied with her care, but that she got better faster. So I saw that misconception, yes, hospice talks about care. But what was interesting was when we first had the conversation with her, we didn't say hospice. We just said, this is a service. You're going to have the nurse. They're going to keep you comfortable. We didn't mention hospice, and she agreed 100%. And it was interesting because we were all told never to say the word hospice, because that was like the big no-no. We didn't want to say it.
And that is a big misconception that patients have. They hear the word hospice and they immediately think that it's doomsday. They think that they're going to be dying within the next 48 to 72 hours, and that really is not the case.
And they're running in the opposite direction.
Absolutely.
Absolutely. The other thing that we really wanted to talk about was patient choice. Such a hot topic right now, such a hot topic in Pittsburgh, because we have these two conglomerates with managed care. We have insurance and hospitals and related. We have a big issue right now with patient choice. What happens at the time of hospitalizations? We've had for years where patients didn't really have the choice of where they were going after the hospital stay. A lot of patients have complained that on their last stay, usually on a Friday night, the family will get a call and say, hey, mom and dad, they're coming home today. Guess what? Surprise. None of the services were in place. Now it's shifted, and the conversation has really shifted to patient choice. So the biggest thing for me is, how do we educate ourselves to make the right choice as a patient? Someone who hasn't had a history of needing hospice or home care, we're hospitalized, we don't know what services are out there. We're not even sure what insurance benefits pay for services and how that would be incorporated. But we know we want to come home because that's our ultimate goal. So what exactly should we do to prepare ourselves for that and to make the right choice as a patient?
Research. Get online, research the different agencies and the different services available, meet with them, interview the agencies. Because every agency, even though we're governed under the same set of Medicare guidelines, every agency is going to have different people, different personalities, and you may like one agency much more than another. So my suggestion is always to, I mean, obviously if you're going to go buy a house, you don't always buy the first house that you look at. You're going to look at different houses, and with your healthcare alternatives, you should do the same thing. Talk to the administration, talk to the management, talk to the day-to-day staff, because they're going to be the ones coming into your home, having access to everything that you own, and you want to make sure that you can trust those people that are coming in.
So I like what you said. You said to really talk to the management, the frontline staff. I think that's very important. So ideally, there's a lot of times, you only get to meet with the patient intake or the outside sales rep per se in our industry. But you won't meet with the people that are dealing with your schedule. You're not meeting with the people that are governing your care. So I think that is an absolute brilliant idea. And do you find that a lot of times patients that go that extra step and really ask to interview kind of the whole staff, I mean, do you find that there's a difference in care? Are they more satisfied in the long run with their services?
They are. There's less turnover. I truly believe in meet and greets. Maybe if you're looking for a nurse and a home health aide, ask the agency to send maybe 2 nurses and 2 home health aides so you can meet them, because not every person is going to like every caregiver.
I really like that idea, and I think the viewers will really understand that it's beyond just picking up the phone and calling. I think seeing face to face who you're going to be talking to day in and day out, and especially because during your hardest time, you really want to have personalities that you're compatible with. I think that's a key that a lot of times we really don't think about or we somehow overlook. But I always say, even in home health, I say it's a lot like a dating service. The first time that you meet that caregiver or that nurse, that might not be the right fit. And being able to say, this isn't what I want. I would like something else, or I would like to meet a new, nurse or a new caregiver. It's okay to have that conversation. And I think more people need to have that conversation before they're in a situation of really needing that care and making that choice. Now, what would you say about hospitals or care staff that are saying this is the organization that you need to choose?
I think people need to be educated that you always have a choice. I think if that is the case, I think that interview them, meet with them and interview them.
I agree. I think it's not a one glove fits all. I think when we try to say everybody go to this agency, and you think that you're following the group and you think, oh, well, everybody's being pushed to this agency, or I'm not sure that that's the best agency, because just like you mentioned, every agency has a different management style. Every agency has a different frontline employee. Every agency is different. So we cannot say that this one agency is going to meet all of your needs, because the unfortunate thing is, without that research, you're going to be making the wrong decision, and ultimately you won't be happy with the end result. So I think it's important to understand, long-term planning, and we're not talking just end-of-life planning. I think just long-term planning, knowing the different organizations, knowing the different payment options, the different program options, and being able to do that is really going to be the key to long-term success.